and welcome back to the Senior Living Show. Today we have John George and Nichole Huffman with ACM Care, Autonomous Case Management. Thank you both for being here with us today.
Thank you for having us.
And Nichole, can you tell us about ACM Care and how does case management work?
Sure. So case management is what we specialize in is medical case management. So we have a team of nurses who like to provide assistance to seniors and disabled adults. So what that looks like is sometimes us meeting with a family member or the client themselves, and we try to guide them, join them with their health journey, and help them understand what's going on with their own health and their medications. Assist them with doctor's appointments if they would like, assist them with understanding the medicine and organizing the medicine if needed, and in general, just trying to coordinate their care. And when it comes time to transition, whether it be they no longer are suitable for their home, we can help them look at the best options. And then even towards end of life, we can help them decide what's the most appropriate decision and guide the families to just make decision making a little bit smoother and easier.
Yeah, that's very helpful because that can be a very hard journey sometimes, trying to navigate all those different ins and outs of it. John, can you please explain the charitable side of ACM Care and how did that aspect start?
Absolutely. I'll start with the fact that our founder and executive director, Julie Hess, 25 years ago now, started ACM Care. And it was on the need, it was an inspiration. She had a family member that needed her help. She is an RN, of course. And it was very difficult for that person to process, in this case, her mom and dad, to process a situation where one was going to have surgery. And back 25 years ago, it was very popular that people would, in fact, their doctors would say, after you go through the surgery, you're probably going to need to go into some type of nursing home or assisted living. And Julie saw in that situation that there was not a need for that. They just needed to navigate the situation, the medical situation, and get through it. And once that happened, obviously they were able to stay at home. That was the inspiration for ACM Care. Julie saw that other people were being asked to do the same thing. And she saw that if we could be an advocate for people, then we would go ahead and get them through their process, whether that was 4 months or ongoingly. As it relates to ACM Care, as Nichole pointed out, we not only do that for paid clients, but we will, of course, do that on a charitable basis. Julie felt it very important that we help people regardless of their ability to pay. So on the other side of this, we have a charitable group that we are able to help. They have some of the similar medical problems that our other clients have, and we help them get from point A to back to where they need to be so they can stay in their home. That could be a veteran spouse, or someone that is low income. We've helped a variety of people in that way.
Great, thank you so much.
Yes.
That's very much needed in this industry. Nichole, can you tell us about the services you provide and what makes ACM Care unique?
Yeah, so what I think we should highlight is we try to provide peace of mind for families and the clients. So if you are worried about a loved one or yourself, you're looking to get help, or there for you, trying to help family from a distance. So oftentimes we encounter children that do not live here anymore, and they're adult children that are trying to help their parent that's still living here. So that is a client for us. And somebody who's just looking for caregiving assistance. So maybe they're struggling with getting reliable care, or they don't know who to go to for care. We have definitely built a rapport with the industry in working with reliable, trusting resources. So we will give them recommendations based off of what we feel is best suited for their needs. And then, something I want to highlight is hospitalizations, kind of as John has talked about, and rehab. So when somebody goes into the hospital, oftentimes they are giving a new diagnosis, or they are started on new medication. Sometimes the medicines that they were taking for years is no longer on their medication list, and there's kind of this confusion period of what to do and what should they continue to do. And then that sometimes they transition from the hospital to like a rehab, whether it's a acute rehab or a skilled nursing facility temporarily. Again, there's some medications that sometimes are getting compiled on, and it's just a mess. So that's what we are here for, to help that individual and the family navigate that, to try to really declutter that. Get those medicines down to a normal amount and normal level for them, and working with those doctors and making sure everybody is in communication, really. So really, at the end of the day, we're just trying to be an advocate, and make sure that they are getting to live as independently as possible, and just providing those resources that we feel might be of benefit in that situation.
That's really helpful. And can you attend doctor's appointments with a client as well?
Yes, we can. So some clients do find that very beneficial. I've often had remarks that when we go to those appointments, they are really amazed, because they did not realize that their doctor would stay in the room that long and actually talk with them. And they feel like they get a lot more out of those appointments when they have another professional sitting in with them. So we're able to really get to the bottom of what's going on and help them to determine the next steps, if there's additional testing that needs to be done. And we really work with them too to weigh out what's kind of the pros and cons, because sometimes, maybe surgery is on the table and that maybe does make sense for their situation, and other times it's too risky for that situation. And we work with them. But ultimately, the client or the decision maker is, if it's the power of attorney or whoever is that decision maker, that's their final decision. We're just really guiding them on what we've seen in our professional opinion.
That can be helpful, because it can be a very confusing time going to the hospital, even as a previous caregiver myself, just trying to navigate the emotions and everything going along with it, as well as trying to become a doctor and educate yourself. So it's very helpful to have a clinical person there and giving guidance.
We really try to just be an extension of the family, just somebody to help really join that journey and guide them, and hopefully take some of that extra stuff off the person's plate that's really shouldering the burden of being the caregiver, especially the primary caregiver. It's often difficult. So when we have couples, we are always identifying kind of that healthier spouse and making sure that they're taking time for themselves and making sure that their health is still remaining top priority, because usually those situations highly depend on that healthy spouse to stay healthy.
Yes.
So
self-care is very important during those times. That is for sure. So John, can people contact you for general questions?
Absolutely. I'm here to do just that. Our phone number is 314-293-0697. That is our main number. People can also contact me directly, jgeorge@acmcare.org. Again, the org being nonprofit. And from that standpoint, I'll try to answer the general questions that people might have about us. Then, of course, if it needs to be something clinical, then we'll bring Nichole and the team in to handle something more direct.
Okay.
But I'll try to filter as many questions as I can for people.
Great. And Nichole, who's your ideal client at ACM Care?
Right. So oftentimes what we are telling people is just, if you come across somebody who is disabled, or a veteran or a senior that maybe has just been struggling a little bit more. Maybe they're going in and out of the urgent cares or the ERs a little bit more frequently, or a family member has noticed this decline when they've come in from out of town, that we are kind of that go-to resource. So, contact ACM Care or contact a care manager in general, just to kind of get a general analysis of what the situation is. We, as you kind of mentioned, being a family member, being a daughter or a son, it's a lot harder to really control the situation when it comes to an adult parent. So we kind of come in as that just third party. We're not taking sides. We're really just evaluating the whole situation and giving our value of what we think is best for that situation. So and individuals who maybe see that they have a diagnosis of something that's going to be ongoing. So a lot of times Parkinson's and Alzheimer's or any kind of memory impairments are generally a progressing disease. And we never know exactly how that's going to progress, but we want to stay on top of that. People who have chronic conditions like diabetes or heart conditions like heart failure or high blood pressure, things that need to be controlled, kidney disease, just anything that would be something that you're regularly kind of really checking in with a doctor, whether it's neurological or heart related, we are there to just kind of join that journey and help them.
Great, thank
Yeah.
you. And thank you, Nichole, for being here today. We appreciate your help
Thank
with the
you so
community and educating us about what care managers do and what ACM Care does for the community. We appreciate that.
Thank you.
And thank you for watching the Senior Living Show. You can find ACM Care's contact information in the show notes and at guideforseniorliving.com. Thank you.